Hello, everybody. It's one of those audiences where you talk back. That's not fair. So welcome to Visiting Nurse Association of Texas, London Learn. If you have not been here before, you probably walked by the glass windows over here and saw this is where we make all of our meals for our Meals on Wheels program. There's a little brochure in front of you for those that are here in person. It talks about our different programs. So Visiting Nurse Association of Texas, we are the Meals on Wheels provider for Dallas County. I actually am dressed like this because this morning I delivered a route with a U.S. Congressperson's chief of staff in South Dallas. So we had a great time, delivered to some really great clients, good conversations. But we deliver to 5,000 home delivered seniors every day. It's not one orders to that many clients every day. We make roughly around 2,000 more meals each day for senior centers in Dallas County. That's a big program, right? It's one of the largest meals programs in the country. However, that's nowhere nearly as large as our palliative and hospice care program that we provide throughout all of North Texas. So you'll see information in this brochure about that. And Olivia Rogers, who's our chief nursing officer, she can wait for me. If you have any questions about palliative hospice care, you can certainly come over and ask me about that. Today, we're really excited to hand out our community health workers and our community Wilson who runs our meals program to talk about that program. One of the amazing things that came out of COVID, there was a lot of things we didn't like, but I think there were a lot of things that we were able to kind of discover and learn about was really a great need for us to not only deliver those meals every day, really how do we provide our clients with additional support? How do we knock on those doors, visit with them, help them get resources that maybe they don't have? How do we connect them to other nonprofits and other organizations that we work with in the Dallas community? The best way we're doing that is, number one, we do that through when people deliver, they tell us in the app, hey, this person needs someone to reach out to them. And that's a great way for us to connect. But the best way of these folks to and their ability to go out and really talk to our clients and sit down with our clients and learn the needs that they have, and then for us to come connect them. So this program is one of the best things that I think we've done in a very long time, because it really allows us to learn much more about our clients and really to dig in and see how best we can support. So I could talk a lot about it, but I'm not there. So I'm going to turn it over to Inga and our community health workers and so forth team, and they are going to give you guys great insight into the work we do. Ask questions, be engaged, and we appreciate you guys coming together. So thank you.
Thank you, Chris. My name is Inga Wilson, and I'm the managing director here at Meals on Wheels. I do see some people that I know in the audience, some of our volunteers. So thank you all for coming today. And our team is going to introduce themselves, and then I'll just give you a brief overview of the program, and then we'll get going from there. Thank you all again for coming today.
Hi, my name is Taylor Sneed. I'm the social worker here at the Meals on Wheels side. I've been here for about a year and a half now. Love the job, love the opportunities that was presented to me, and I'm just teaching about this.
Hello, my name is Risper Ochieng, and I am one of the Dallas community health workers here with Meals on Wheels. I'm coming up on a year, started here in April, and it's been a great story.
Hi, my name is Martha Gonzalez. I'm almost a year also in April, and I'm a community health worker.
Hello, everyone. My name is Rose. I was actually the first community health worker onboarded to Meals on Wheels, and I serve specifically the Irving area, and I love my clients.
Hi, everyone. I'm Lakia Coleman. I have been a community health worker since 2017 through AmeriCorps. Shout out to AmeriCorps. And I've been here since February of 2022, and I'm really grateful to be here.
So just to give you
Just to give you all an overview of the program, VNA wanted to, create a program that would provide a more robust offering of services to our Meals on Wheels clients. We've been able to do that through hiring our community health team here. The community health workers go into the clients' homes, they provide awareness about senior hunger, what VNA does, and all of the services that VNA offers. The community health workers, once they, are provided the information about clients who might need a home visit, who might need additional services, they schedule a home visit, they go into the client's homes, they do an in-home screening, they look around the home to see what other services they might need, and then they either connect them to those resources or, let us know here at the organization because we might be able to provide those resources for them. As Rose said, she was our first community health worker that we hired in 2021 through the city of Irving. We have, through their community development block grant program, we partnered with them since 2018 to provide meals to clients in the city of Irving. We also have our social worker Taylor, who's on staff, who works closely with the community health team. And this role is very important in connecting clients to resources to help them stay safely in their homes. So from here, we're just going to ask them a few questions so that you can get to know them better and then understand how the program works. Okay, my first question is for you, Rose. Rose, can you tell us what a community health worker is and describe the work that you do?
So as a community health worker, we serve as advocates for our clients who have limited access to either health services or social services. We act as liaisons trying to close the gap between these services that they need and the client. For example, it's easy for the doctor's office to set up the appointment, but how do they get there? So we help them from point A to point B. We come in and close that gap. I would say our most common resource that they request is transportation. So that's something we do. We also provide direct services such as health screenings and health education. Our health screenings helps us determine the clients that are in need of higher level of care. And then our health education, we help them stay independent with our fall risk brochures that we give them and our medication facts list. We also, our desired outcomes are improved access to healthcare services, increased health and screening. We also have enhanced communication between community members and the health providers. So we have constant communication with their health providers in case they do need a higher level of care. And then reduce need for emergency and specialty services. But most importantly, I think it's creating that bond so they feel comfortable enough to, contact us when they do need extra services.
Thank you, Rose. My next question is for Taylor. Taylor's going to help us understand what the social worker role is, and she's going to talk to us about her day-to-day interactions with the community health workers, clients, and our various partnerships.
Hi. So of course, the role of a social worker varies from agency to agency. I would say my role focuses a lot on resource referral. So like they've already stated, getting our clients connected to those social services, those agencies that they may need, help them get to a stable and independent place of living, as well as resource collection, which is something we all work in, where we're constantly gathering new resources, communicating that with our team, making sure everyone's aware of the types of services and agencies we have within the community that might benefit our clients. So that's definitely a major part of our role. Another part is offering support to our community health workers here. Can offer them guidance through certain client situations, client issues they might be dealing with. Every situation is kind of unique, so we try to figure out what the best plan of action is for each individual. For each individual client. So they can call me, we can kind of work through what that situation might be, what might be the best agency to contact, just best plan of action for that client specifically. And then lastly, a major part of my role here is maintaining our social partnerships and our social programs as well. So we do have partnerships throughout the community that allow us to get referrals from clients. So we have partnerships with local hospitals such as Methodist, Texas Presbyterian. We also have a partnership with a physicians group, so they can all send us referrals for us to get these clients added on meal service. More recently, we just made a connection with the Dallas Crisis Intervention Team. So they are also able to send us referrals and we can get clients added that we might have typically not been able to see. And then our other ones are our social programs. I'll talk about those in a bit more detail later. But we do have a few social programs that we participate in to give our clients a little bit more opportunity for other things. So those main ones would be the Brown University Research Study, our McKesson Cancer Program, and then most recently is our Sunshine Connection Program. I will talk about those in a little bit more detail, but that's part of the overarching idea of what I'm going to do.
Thank you, Taylor. Lakia, the next question is for you. Want you to talk about how you all as community health workers are recruiting, people to add on this on field service.
Thank you for the question. Just like, Chris had mentioned, the volunteers let us know when they come across issues with clients, if they have any health issues. And that shows up on what we have is called a client issues report. And so, every day we have a day assigned for us to check it and follow up with those clients. So they have health issues. And we go and we schedule home visits with them to see what other health resources we can provide for them. Another way we do it, as Taylor just mentioned, the loneliness assessment. That's a good way to identify if someone needs additional resources as well. Just getting in contact with our clients in that way. Another way is when we do the meal routes ourselves. We also do meal routes once a week, or however our company needs us to assist. But at least once a week, we also assess, and we go in different areas also across Dallas County, to see what's going on, to also, provide them with additional resources, possibly in their home. Another way we receive, this is through, Bamboo, which is our partnerships with the hospitals that we have. And so we receive them from you. And, we also receive hospital admissions as well from Inga. These are frequent flyers that come into the hospital. And so, you know, if you keep coming into the hospital, you want to know how we can help you. And I believe that is generally how we receive it, as well as when we assist with additional tasks. Recently, we did a nutritional risk assessment. So while we're doing those nutritional risk assessments on clients, that's also another really perfect way to ask if they need additional resources. A lot of our clients still need a lot of additional food resources, just transportation, home health aides. So these are ways that we identify our clients.
Thank you, Lakia. And our community health, workers, they go out into the community. We have a lot of organizations who reach out to us to let us know that they're having health fairs. And so the community health team, I'll get them scheduled. They'll go out to these different health fairs, different community organizations, senior centers, to talk to clients about potentially signing up to receive meal service in their homes. My next question is for you, Martha. So Martha's going to talk to us about the health screening process and how the community health workers end up referring clients to additional resources.
So once our clients have been identified or referred to us, a home visit is scheduled. And once we're in the home, the main purpose is to get into the home. And once you're at home, you can identify different factors that they weren't aware were going on. And through those factors, we can refer clients to either higher care, have their spouse who they're taking care of and they're the sole caregiver for both of them, to higher care, refer them for additional meals, refer them to, the RAP project, because many of our homes are multi-generational homes, to where the parent, the client, and, somebody that may have disability can all benefit from a specific resource. And, we connect them to additional food. And when you have a client come and tell you, I am so thankful for this program because I have gained weight through it, and my doctor's very happy, that makes, the world of a difference in their health and their quality of life. Other than the health screening, we also ask them what is going on outside of health. Because many of the times when we go visit our clients, they are not aware of all the resources that are available for them, or that there is something to help them out in addition to just the meals. So identifying those factors and asking them if that's something they would be interested in, facilitates the care of their loved ones, themselves, and it's a win-win situation overall for both the client and agencies able to get into the home and provide those needed resources.
Thank you. So my next question will be, this a joint question, is for Whisper and Rose. Want you all to, describe the type of client that you all see and how we help them age safely in place, and share specific stories.
So the majority of our clients, unfortunately, live alone, or not necessarily unfortunately, but it just opens them to a variety of different, outcomes. And CRISPR has a very specific situation that really explains how we are more than just a meal.
Yes, so I think like Lakia touched on with our clients, we like to get out in the community, meeting people at different places, and when that's through meal delivery. So I think some of you guys are familiar with food delivery, you've been on routes before. And this time I picked a route in Irving. I just had never been on the route before. I was like, just for some reason, I decided to go on that day. Sometimes I procrastinate. I was supposed to go on Monday. But so I went on Tuesday to make sure I went. And I'm so glad that I did, because a key part of our role as community health workers is providing an additional safety net for clients. And a lot of that times is just being able to see someone face to face. So I roll up in my car, run with my license plate, I come to the doorbell like normal, but I don't hear anything. This is the usual time. That's strange. So I go through my list, I get a call, and I'm like, I don't hear anything. I hear a noise from inside the house. And then now I'm calling his cell phone, and I hear the phone ringing by the door. So that's instantly very strange to me. I take a few more seconds to listen in, and I actually hear someone calling help from deep inside their house. Instantly I panic. I'm new to the role, new to meeting new people. I'm shy usually. And at that point, I think I need to call 911 for this client. So I sent a quick message to Taylor, our social worker. She's like, definitely call 911. And so I called. It's my first time ever calling 911. And luckily the Irving Police Department, they get my information. I have the client's address, phone number, first and last name. That's very helpful. They actually come within I think they came within 15 minutes, which was amazing, because the whole time I'm yelling into the house to, I'm calling 911, help is on the way. Help comes within 15 minutes. The police officers, try to open the door, front door was locked. They go in the back door, to kind of not the whole integrity of his house, just go in the back door, make less of a mess. They actually found out that our client was in his bathroom. He had fallen, he had slipped and fallen the night before, and he had been on that floor all night. And it's like Chris mentioned, we deliver over 5,000 meals a day. Sometimes we don't have enough volunteers. So if I hadn't picked up that route, I really hate to think what would have happened if someone didn't come to his house that day. He was bleeding out, and the police and firefighter said, you saved his life. And that's the power we all have, I think. Because it was an urban client, I immediately got in contact with Rose. She knows him, she's like, oh, he's usually by his door, he's usually ready for the mail delivery, he's a sweet man. He ended up being taken to the hospital, and Rose, because she knows him, we're all familiar with him, she was able to follow up with him, he got the help he needed, and I think Rose can
Yes,
talk
so I
about that.
followed him the next day, followed up with him, I'm sorry, the next day, he was at the hospital and he had, he had been there since the night before. And he was extremely thankful for us and, you know, we just don't know what would happen if that wasn't the case. Thankfully, he was able to go to rehab and now he is back home and back on wheels, so.
Thank you, Mr. and Rose. This is an example of what we do every day. We could not do that without the help of our volunteers and our paid drivers. So thank you, Mr. and Rose. And I was just going to share some numbers with you all. So as I talked about in the beginning, the community health workers, they do health screenings, in-home health screenings on our clients. And so for the past 8 months, they've done a total of 340 in-home screenings for our Meals on Wheels clients, 135 phone screenings, because sometimes the clients are not comfortable with us coming into their homes. So in the past 8 months, this team has done 475 screenings, health screenings. Which has allowed us to connect them to additional resources and also connect them to the continuum of care program we have here. Out of these numbers, we've been able to make 13 referrals to palliative and hospice care for our Meals on Wheels clients. And so for our final question to our community health team, each one of you all, I want you all to tell us why you love this work.
I don't know this work, easier. I just really enjoy working in this environment because like the example first we were giving, you really never know the impact that you're making, on these clients. Food is one of those things that's so easy to take for granted until you're signing someone up for meals and they're in tears on the phone because they haven't eaten in days. So things like that really make are so impactful and really affect how you go about your day to day and what you appreciate. And then just working with this company, working with this team, watching something grow from basically nothing to so extensive in such a short amount of time. It's really amazing to watch something from the ground up like that, especially for a company that's been around for 90 years and they're still over here trying to grow, trying to improve, trying to, figure out what the best type of services would work for our clients, what would offer them the best continuum of care, aging with dignity. So it's just really empowering and impactful to see a company that's been around so long, still trying to make adjustments, still trying to grow, still trying to better themselves for the sake of our clients.
Yes, what I love about it is the connection, being able to get out in the community, help out our older neighbors, and also get people excited and engaged to be a part of it, because I think we all do depend on each other, we're interdependent, and by just adding some assistance, giving our clients one less thing to worry about, they're able to, live the lives that they want to a little bit easier.
The reason I love this job is fulfillment. Because every time you go out to the client and they get the help they need or they get the assistance that they are needing, it's bridging the gap between the client a quality of life that otherwise they would not have access to.
As someone who has been advocating for their parents as soon as I was able to translate, I feel like it's very empowering being able to do this for others. And I see the importance of it throughout the community. And of course, as Martha mentioned, the direct impact you're making on people's lives is definitely something.
Self-advocacy, is just, trying to communicate for yourself that your needs was really important to me. As I mentioned, I started this work in AmeriCorps, in Chicago, from Chicago. And, I was in AmeriCorps there, and I was at a hospital, and just the amount of people who didn't understand healthcare really saddened me. So I love that in this position, I'm able to not only educate someone on their health condition, but also give them the self-confidence to speak up to their doctor and ask them, what is this pill for? What's going on? Because I'm an advocate for prevention over treatment. And so while we are in this situation, how can you be more comfortable with living with your situation? And so I love to be able to provide that extra comfort of care, because a lot of times the clients feel better and more comfortable when they call their community health worker than a doctor or a nurse. So I'm just really blessed and grateful to do this selfless work. It's just a bonus to have a check. So, thank you so much, for coming and listening to us and truly just, seeing our hearts from our words.
Questions from the group, and then I'll have a few from the folks that are joining us online, but does anybody have a question here?
I have a question.
Here, I'm gonna.
That's okay, I talk loud. Is everyone that applied eligible?
It applies for Meals on Wheels.
No, our general eligibility is 60 or over and disabled. We do have some leeway, of course, just depending on our different funders and our different partnerships. We do, of course, try to get as many people onto service as possible. More recently, we've been looking at gearing towards not only elderly, so with our partnerships, like our hospital partnerships, our crisis intervention teams, those aren't necessarily 60 plus, but they are people who are in need of the service.
That's a great question. We do have, Meals on Wheels is funded in a variety of ways. It's a real public-private partnership. So in addition to charitable funds that come from you guys and from grants, we have different government sources that, and hospitals that actually pay for the service. And so they will refer that to us, and sometimes it covers all of the costs, other times it doesn't, but that's what we raise money to make up that delta so that we can serve more folks.
How old is the program?
The Community Health Work Program, we started in 2021 in Irving. And then Dallas County had a grant that we started to add additional folks. So through the American Rescue Plan, actually, is who funded that. That's a federal program that went through the county.
That's all over Dallas and Irving and.
We serve all of Dallas County, so that's all 1,000 square miles, 26 municipalities, and Irving is the only one that we're partnering with at this point, the city that's actually paying for her role in funding clients. The rest of these lovely ladies serve the whole county.
I heard someone mention multi-generational families or households. How do you guys go about that, like getting them to become eligible for services in a situation like that?
It all depends on the needs that they have. For multi-generational, like Rose and I speak both English and Spanish, so we can understand more of their cultural, and the barrier is that a lot in the Hispanic community are proud and do not want to ask for their assistance, or their other underlying issues or that are going on that make them afraid to ask for the help. So educating them, letting them know it's not gonna affect them, and telling them what resources are available for them helps them feel more comfortable in asking for the assistance and getting the help that they need.
And I think sometimes there's also, if you're in a household and someone is like a full-time caregiver, there have been some times where maybe we can't do service if it's not qualifications, just to have some people, their husband or wife will go on the program, that kind of thing.
Oh, Okay, yeah, I'd like to know, have, delivering meals always been part of the visiting nursing association?
Yes, sir. For our part of the program, we do all deliver at least once a week. We try our best unless we're really busy, but we do, since the beginning, all started our roles, we have delivered, at least once a week, every week.
Right, and Meals on Wheels, the Visiting Nurse Association, we were started in 1934, but we took on the Meals on Wheels program in 1973, so 51 years we've been delivering meals. Glad I wore my walking shoes.
The resources that you're mentioning for the client, how do they know what to ask for, or do y'all go in and they find out from your assessment?
It goes through our assessments. We identify factors, and then also asking them what is going on outside of health issues in their personal life, that we identify other issues that are going on. I know for a fact that I've been to various homes where the need for additional food, is, and I have been able to facilitate, Zoom meetings with the North Texas Food Bank to help them apply for food stamps and Medicaid. And then we also, if they have issues where they haven't heard from anybody or they do not understand, we'll facilitate to where they can get their questions answered through those resources.
Thank you.
If someone doesn't qualify for Meals on Wheels for whatever reason, are you guys still able to do those assessments for them outside of Meals on Wheels, or is it all tied together?
It is tied to our program, so it is for our Meals on Wheels clients, for if relevant, like our hospice, palliative side, but it is our Meals on Wheels clients that are, get the advantage of the program.
But one of the other things that these ladies do is actually go out to community health fairs and go to other nonprofits to do educational programming, to talk about the services. And so we coordinate with a lot of different nonprofits to provide that. We want to maybe talk about how you guys were just at Wesley Rankin.
So a little different before we speak on that. For example, I visit the Irving Public Library and I try to do recruitment for those who would benefit from the program. However, if I see that they need assistance with any type of resources, I sit there and I, either have them apply or such as the case. So they don't necessarily have to be a direct Meals on Wheels client. That is the ultimate goal if they could benefit from it. But if they need help with resources and we're there and we're able to help them with that, then of course.
At the community events, we try to interact with other agencies and find out what their resources are and what they're offering. And we trade our information, both so they can refer us, we can refer them to get the resources our clients need. So every event we go to, we gather more and more resources that could benefit our clients.
I think what you're all doing is great. I mean, and VNA overall. My question is under medical care, whether it's a health assessment or just, do you have care coordination with like their medical assistants or nurses or doctors? It may not be frequent, but that was my question.
Yes, so through our assessments, once we get in the home and do the assessment, based on their score, well, no matter what, we get their doctor's information and we also send an assessment to their office just for them to have it on file. Then if they are maybe recommended for a higher level of care, we do coordinate with our hospice and palliative care team. And from there, they work with their doctors and their insurance to provide additional medical care.
On top of that, we've gone out to see patients in the hospital with our palliative and hospice department. One, to follow up, make sure they get their meals as soon as they get home. see what additional resources or what else is going on to make sure by the time they get home, they get that higher care they need. Other than that, like, we can go ahead and visit clients at their home. And we've had instances where we go visit a client and then they're the sole caregiver for their spouse. Their spouse is facing the same, if not worse, health issues. And then at that point, they get referred for higher care. And at this point, we're also trying to build to where our clients can have visiting doctors at their homes to help bridge the gap between transportation and healthcare.
Hi, I understand that, you was, saying that you did phone assessments over the phone, you know, put people over the phone or internet assessments over the phone. Those people that, you know, do go phone assessment, but, some of the people, clients that we go out to, that's what you do, that's what we gather. And I don't think they're, actually giving the right information to you guys. And some of them probably do need more, additional needs and stuff like that. So how do, as, these volunteers go out to, see these people, how do we, get them, be able to, I guess, refer them or get them to get the nourishment that they need? But some of them need food. I know some of them get breakfast and lunch, and some of them just get lunch. And then I know that they need food.
So, the best way to communicate that information to us would be through the client issues report as mentioned earlier, that mobile app that, all the drivers have access to as they deliver. We always ask for you to put as much information in that as you can about the client, whether it's food related or it's health related. We do ask that you enter that because we do pull that report daily and the community health team does address it as needed. So if you are seeing concerning living conditions, clients mentioning that they're not, you know, this one meal a day isn't doing enough, please enter it into that report as you're delivering and then we can try to address it as we can.
First of all, let me say that I think you all are doing a fantastic job. Yeah, it can't be a cure-all for everybody. Most of the clients, and these are the delivery people who go from Greater Golden Gate, these 9 people. I'm just the coordinator in one sense. Since most of the people that we minister to, I guess you could say, they live alone. How much participation do you all get from the family member in assisting you? Because most of them that we talk to are alone. What's the participation of the family? How are they involved?
That is definitely a loaded question. It definitely varies from client to client. I know we all have different experiences as far as family members. Some family members are very involved and we can get everything that we need from them. We try to have emergency contacts on file for all of our clients. That way we can reach out to whoever they're comfortable with whenever they're dealing with some issues. We do come across, like you're saying, a lot of people who don't have that family member assistance. As far as that, we just try to bridge the gap where we can. We do ask if there's anyone in the family that can provide assistance, because at the end of the day, a lot of issues can be resolved by that person, a close family friend or family member taking you to the hospital or things like that. So we do always try to get, try to figure out who they're involved with, whatever family members we contact, if that's possible, to get them involved. But the reality is, some people don't have family members, they aren't that close with their family, they're not comfortable. Someone that me and Martha just visited last week, he did have family members, but he wasn't comfortable with his sisters helping him. And so it's very difficult to bridge that gap because we can't make him want to work with his family. We do try our best. We explain to him that will probably be the best solution as far as getting you assistance, but you know, it's just trying to work at the client's comfort level. That is a big thing with us. We don't want to force any type of help. We don't want to force anything that would make the client feel comfortable. So we are trying to work at their comfort level. We're not going to contact a family member if they're not comfortable with that.
Tim, will you explain a little bit about, so that's a great question, right? And how do you bridge that gap between people that live alone and don't have family members or a resource or whatnot? So two things that we do. One is the Sunshine Calls program through Factor Health, which is part of the University of Texas. And then also the partnership with Senior Source. Can y'all talk about those two programs? Because they're not family member type program, but it is a way to help additional connection.
Yeah, so we have a couple of programs that kind of focus on relieving the feelings of isolation and loneliness with our clients. So our newest one is the Sunshine Connection program. We've been working on that since about January this year, so it's only a couple months, but it's going really well. We paired with UT Austin Medical School to provide empathetic callers to our clients that are interested. So a regular caller will call them over the course of 4 weeks, and it's a client-led discussion. It's whatever the client would like to talk about forever, as long as they want to. It's really just there to kind of offer that sense of companionship, just like I said, alleviate those feelings of loneliness. So it's not necessarily something that is for health, physical health, but it is definitely something that helps on the mental health side. That's so important for our clients to have that little bit of extra social connection. Like you'd be shocked at something as simple as someone calling them a couple times a week. That will make such a big difference in their lives, how they're feeling. And so that's a new program that we've been participating in. We've definitely had some great reviews from that, and we're always happy to provide that little extra care to our clients, even outside of the meal service. And then we're also connected with the Senior Source program, where they have a senior companionship program, where they can pair clients with volunteers, with other senior volunteers, just based on the living area and availability. Same thing, it offers that sense of companionship. Someone comes over regularly just to kind of visit with them, talk with them, help them out here and there. So those types of programs really help bridge that gap. Or if someone doesn't have family or friends, someone that's still over there, checking in on them regularly, keeping that regular social contact, just kind of, keeping them motivated.
I also want to add to, one of the biggest things that clients ask for is a home health aide. So they also come and help that as well. So I know a lot of times family may come over, prepare meals for their, for the ones who are connected, prepare the meals, take them to their doctor's appointments, take them grocery shopping. This is also what the senior companionship program will do. They also help clean up around the house, take them to maybe a senior center as well. They basically pick up the role that a family member would do as well for them if they don't have that.
That's the Senior Source?
Yeah.
Is that?
One more question.
Hi, if we could just piggyback real quick to when you were talking about eligibility, are these clients, people who don't qualify for food stamps or any of those types of programs? Because you did say that you assist with those applications. So the clients that do receive meals, is it because they can't receive food stamps or any of those type of government assistance?
Taylor, why don't you address that and I can hook you back?
Not necessarily. Plenty of our clients do still receive food stamps. Most of our clients, I would argue. So it's more of a supplemental meal. So I would say a lot of our clients are still receiving government assistance along with the meal service.
Meals on Wheels is designed to meet a third of the nutritional intake of the day. So it's not meant to be totality, it's just an extra layer of support to provide food for someone who may not be able to prepare it. And also to provide that eyes and ears. So it's just an extra layer of support to help people age in place. Okay, you can ask
Again, I think the program is great. These are great testimonies. I love when you all went around the panel and said why you do it. So I don't know if my question is to Jen or Chris, but once you build up such success, is the program ongoing and funded? I think Levi asked, and it was 19.
I will answer that. We're gonna become good friends, I can tell. So, again, we serve around 5,000 home delivery meals each day, another 2,000 congregate feeding center programs, which 31, right? And we provide this to, say, typical senior center. The most recent study that the city of Dallas helped us with, they looked at the entire Dallas County. And they did a study, did a little bit of research for us. And in Dallas County, there's roughly 2.5 million people that live in Dallas County. There's 26 municipalities. People always think that Dallas is, obviously it's the biggest, but Irving, Cedar Hill, Duncanville, so they're all the way down the line, right? In Dallas County, there are 290,000 people that are 65 and older. 50,000 of those people live at or below the poverty line. So what we asked, the reason why we wanted that information is because that is the answer to your question of when do you end, when do you stop? And I think for us, could we ever get to 50,000 meals? Great, but I don't think we could. But we could get to a good, comfortable number of how many people we can serve with the amount of resources that we have for those people that want the service. Because I think what these guys have discovered, and we've always known, is you have a lot of seniors out there that need Meals on Wheels. But a lot of them will never take it. Just for whatever reason, they just don't want someone coming to their home, or they don't want that interaction. But let's just cut that number in half and say it's 25,000 now, and we're at 7. So we've got, that's our why. That's why we show up every day and do our work. Is really how do we get to the point where we're providing meals, whether it's through knock on the door or senior center or all the partners that are out there, all the other nonprofits that are providing meals to people every day. How can we become partners with them to meet that gap? And that's really our objective. Yes, 5,000 meals a day is one of the largest meals programs in the country, but for us, it's about how can we make sure we're providing meals for as many people in Dallas County that want those meals. So, yes, ma'am.
I'm sorry, I have one more question for you.
Yeah.
I know of some seniors that on the, I would say property line, but they're not able to because the system says that they make too much money, but they're not making enough. They just started paying their rent or getting no food stamps. They are making just a little bit more over the property line to receive any kind of assistance. So what about those people?
So I would say is we take every referral and we then assess to make sure that they can meet our requirements. And so never say, I'm not gonna send that person's name to Meals on Wheels because I don't think they need it. Let us make that assessment because there are funding sources that will allow us to, as these guys have said, excuse me, will allow us to provide meals to people. And so we need to be the ones that sort of walk through that kind of intake part to figure out, do they qualify for meals? If they don't live in Dallas County, we do a really good job of referring them to other programs, other meals programs. Tarrant County has an amazing meals program. Collin has one, Denton, all around the state of Texas and all over the United States. And so we're able to refer clients that don't say, we get calls all the time, people that live in Denton County, and we're like, great, here's how we're going to connect you to that program. So I would say is send all referrals to us and let us figure out how best we can serve those people.
Chris, do you want to talk about what happens after ARPA funding?
Oh, yeah. So after the ARPA funding, part of the thing that we're doing is we are raising additional dollars. Again, we've really already started, but really to raise dollars so that this program will always be here. A big part of our objective was when we asked the county for those funding was help us add people to service, particularly those clients that were going to senior centers before COVID. And then when COVID ended, the senior centers opened, they saw like a 50% reduction in people coming back. So we knew there was people out there that needed meals. So give us funding to add people to service, which we did, and helped us kind of get to that, close to that 5,000. But it's also to pay for these guys. So our objective is for keeping them, we're just gonna raise it in any way. So that comes from donors, it comes from, our state funders, and it comes from volunteers and donors who has to help us do that. So did that answer your question?
Yes.
Great.
Hey, you're up.
Yeah, I'm like. I do have tennis shoes on, so.
The VNA organization here services Dallas County. Do you have sister organizations that do like Tarrant County or Denton County or whatever? Or is it part of the same VNA or is it different?
Yeah, good question. So again, we serve the meals program in Dallas County. Hospice, we cover all of North Texas. But in the state of Texas, there's like 250 to 300 Meals on Wheels programs. So we don't operate the one in Tarrant County. We work with them. So there's one that covers Tarrant. They cover kind of some of the outlying counties in Tarrant. Collin County has a meals program. Denton County has one. And really then you just spread out all over the state. So we are, we're friends and partners. We're not the same organization, but we do work together with them on a very regular basis.
Thank you.
Yes, sir.
The only other study we didn't mention was the Brown study, if we want to explain.
You need to explain that.
Well,
I'll try. So one of the things that we have always tried to do here at Meals is we and Taylor really talked a little bit about it, is how do we do what we do every day, which is provide meals and provide hospice and palliative care in the best possible way. But then how do we sort of expand our reach and our ability to do things that support our clients or could support our community without sort of reinventing the wheel, right? We don't want to go off and create programs that other people are doing. So we partner with a lot of organizations, and one of them that we have been a part of for many years, I think it's probably 20 plus, we've been doing studies, that we get asked by organizations, particularly Brown University has one of the better, I forget the actual terminology of the department, but it's their research on aging, seniors aging program is like one of the best in the country. And so they do tons of studies all around the country of trying to see things. One thing that we were part of years ago does the Meals on Wheels programs actually help prevent people from falling? And the study came out and said that it did. And the reason why is because people that are on meals every morning will wake up and get ready and wait for the client, wait for the volunteer or driver to deliver their meal. And they're a little more active. And so the research showed that if you're on Meals on Wheels, you have less likely to have a fall in your home than if you were not. That's one example. The one that we're doing with Brown now is to determine whether or not delivering a meal every day, knocking on the door, has a greater effect on your health, a better effect on your health, than if you were to just get, as we all get, drop ship meals from, say, Amazon or from a program that just delivers you meals. Is it truly the nutrition, or is it the nutrition and the knock on the door? And so that study is going to finish in like 2025. Preliminary data from some of the smaller studies done, and this one's done with 5 or 6 large meals programs around the country. It's 2,500, 3,000 clients that are in this. Our goal is to have 500 in it. But the idea is, does that determine or help meals programs around the country understand, hey, you delivering each day to somebody and knocking on the door is the kind of gold standard and best way to do that? Or is there a modified way to do that? Is there ways to incorporate home delivered meals through shipping or whatnot? We think, and we know anecdotally and from other studies, that the actual knock on the door is the best way to go. So that study, we're part of that, and that's a good example of a study that we're part of. And we're due a number of those from time to time, because we want to learn from those, and we also want our clients to benefit from some of those stuff. Really good question. Right. Anything else? Anybody else have any questions or thoughts? Well, thank you again for coming, and thank you for those that are listening online. And we try to have these lunch and learns probably every quarter, and we'll have another one will come up probably sometime in the summer, and we'll extend everybody an invitation to that. But I just want to thank everybody for coming today, and really great questions, and we just appreciate all the great support. Thank you very much. And you can answer